So I'm really thrilled to introduce Dr. Gail Gazelle, who is a Harvard Medical School faculty, highly respected physician coach, keynote speaker, author of the book Everyday Resilience, and has multiple publications in high-impact journals. Dr. Gazelle trained in internal medicine and completed a medical ethics fellowship at Harvard. During her career, she has also worked as a surgical co-management hospitalist at Brigham and Women's Hospital, and then as founder and director of Pain and Palliative Care in Boston. As one of our first physician coaches in the US, Dr. Gazelle has pioneered the field of physician coaching and has coached over 500 physicians. Thank you, Dr. Gazelle, for joining us today.
My pleasure. Can we pop the slides up? Jennifer, perhaps you can do that. It's wonderful to be here today, and I'm assuming everyone can hear me okay and can see the slides. We're good there. Good. So we have about 40 minutes, and we are going to take a deep dive into both physician resilience and a very pragmatic look at how mindfulness can be helpful. We're going to look at some cases that I will present anonymously from my coaching practice. We'll review some of the literature, but most importantly, you'll get some practice doing some specific exercises. Next slide, please. So I probably don't have to tell you what the faces of clinician burnout look like, right? The kind of despair that we see, the emotional exhaustion, the sense that the tank is empty, the well is dry, kind of this sense of cynicism and why bother, and very importantly, a disconnection from our sense of meaning and purpose, and also from our sense of accomplishment and all the good that I know each of you are capable of doing. And so if we go to the next slide, what I want to cover today is through the lens of a case in particular and some exercises that we'll do, really want to help you understand what mindfulness is and what it isn't, look at some of the neuroscience, and again, give you some practical approaches that you can take away and use actually today. Next slide. And so burnout, as you well know, is considered a public health crisis. And this actually came from Health Affairs Journal. In 2017, the high level of burnout amongst physicians should be considered an early warning sign of dysfunction in our healthcare system. So a mere 4 years ago, it was really only then that we were understanding the full impact that burnout has on really every sector of healthcare. It's not just that it impacts us as physicians, but it really impacts the whole healthcare endeavor. And if we go to the next slide, that was in 2017, and I don't have to tell each of you that a lot has transpired since then. And so you on the front lines as hospitalists have certainly seen the toll of the pandemic, the early toll in terms of the risk to you and your loved ones, insufficient PPE, incredibly sick patients, and no options for treatment, and the ongoing stresses, the ongoing uncertainty and difficulty in managing things at home and managing all the difficulties that you see in your hospital-based practice. And so what you see in this slide is something called VUCA. And I don't know if you've heard of that term, but I think it's important here to really get at the unprecedented times that we're in healthcare. So VUCA, volatility, all of the changes that we're seeing, all of the kind of rapid action, rapid fire, very volatile environment, uncertainty, what's going to happen next? When you look at some of the stats of the changing face of healthcare, you see that for the first time, apparently since the AMA has been tracking this in the last decade, less than 50% of physicians are in private practice. Hospitals are going bankrupt, as you may be aware. Since 2010, it's estimated that over 130 rural hospitals in the United States have actually gone belly up. And what happens to the patients and the providers in those communities? All of the uncertainty about what the future is going to bring. Rick Pollack, who's the president of the American Hospital Association, estimates that hospitals are going to lose $54 to $90 billion in 2021 as a result of all the complexities of the pandemic. And additionally, the AMA for the first time is looking at what percentage of hospital practices and physician practices are actually owned by private equity firms, and that's up to 4%. So there's a lot of uncertainty. What does all of this mean? Complexity, chaos, turnover of staff, shortages of staff. I know that all of you are impacted by that. Chaotic working conditions, having to see high volumes of patients. And then the A, ambiguity. What does all of this mean? What does it mean for me? What does it mean for my family? What does it mean for my future? So I really want to be clear about what a difficult time this is in healthcare, all of the competing demands that each of you are juggling and trying to manage. Next slide. And so we have to joke a little bit. Here lies Dr. Jones, lifetime RVU below the median. Is this the kind of thing that we're going to have on our tombstones now that every little bit can be measured? So we have to laugh a little bit to balance the enormity of this difficulty. Next slide. And so I want to mention here something that another term that comes to us from the military that you may be familiar with, moral injury. And from the military, we understand that we send young people off to war to do pretty heinous things, things that are likely against their moral compass. But we obviously do that in the service of democracy and country and statehood. But that's what moral injury means from the place of the military. And that term is now being used. Some of you may be familiar with it being used for what's being asked for physicians in the modern healthcare environment. Of course, your duty, your calling is to take care of sick and vulnerable patients. And yet your duties as case managers, getting insurance auths, making sure that disposition takes place, doing all that you can to align and communicate with all the subspecialists, make it difficult. And not to mention the care and feeding of the EMR, make it difficult to actually focus on the needs of the patients in front of you. So that's what we're talking about with moral injury. And you may as well have seen a video by Z-Dog MD, the hospitalist who's also a very talented musician and rapper. He had a 10-minute video about moral injury, and he really said that it is up to the healthcare system, to the hospitals, to the HMOs, to all of the big entities to fix this problem, and that we really can't expect physicians to fix this because the problem lies elsewhere. And it's an interesting argument and can actually take us to a frame of mind, next slide, that you can come to a session like this with mindfulness and this idea that mindfulness could actually help you build your resilience and weather the difficulties you're facing can leave you thinking, well, is this Gail Gazelle just going to be another talk about, keep a gratitude journal, do yoga, meditate every day, and life will be good. And so I want to just acknowledge that there's a sense that until the systems get fixed, how will we manage? Can we really ask each of you and your colleagues to pick up the slack and to figure out how to deal with this difficult situation? So that's kind of what I want to explore today. Next slide. And I'm going to do that in the lens of a case, and I'm going to call this individual Liz. This is actually kind of a conglomeration of hospitalists that I've coached, and I've really tried to make it as confidential and anonymous as possible. But Liz is a 42-year-old hospitalist, well respected by her colleagues, top of her game clinically, does incredibly well in patient care. And she was doing well in her career and feeling relatively satisfied in her career until the birth of her second child 3 years ago. And since that time, she's really had a hard time struggling with all of the demands. She's really happy in her group, but unfortunately, her group, like many hospitalist groups, is perennially understaffed. And that's just on the physician side. Certainly on the nursing side, there are all the staffing shortages that you're aware of. Hospital volumes are high at this point in the pandemic, and she really feels that she's being overworked and undervalued. Just cases coming to her from other services. She wonders why they aren't taking care and why they aren't taking the primary responsibility. She wonders, did I make the right diagnosis? She worries about her patients when she's home. She thinks about the hospital CMO whose income was just published in her local paper, and she's outraged and finds herself kind of ruminating. How could this be? My salary is dependent on RVUs. What if I don't meet them because of all the stresses that are going on here? How is it that the CEO could be making all this money? So this deep sense of frustration. And in addition to that, when she gets home and she's with her 3-year-old and her 6-year-old, her mind is just spinning. She told me actually that sometimes she's sitting there, her 3-year-old gets in her lap, wants to cuddle, and her mind is so busy reviewing all of this, ruminating, feeling angry about the unfairness that she perceives, that she can't even really enjoy the sense of her 3-year-old wanting to cuddle with her. So a lot of guilt, a lot of sense, gosh, I'm not doing well at home and I'm not doing well at work. How am I going to manage all of this? And so she's exhausted. Her mind is kind of running ragged. And she told me it's almost like running a marathon, Gail. But when I ran triathlons in college, at least I rested in between. But now I simply feel like I'm going 24/7. So she came to coaching in the hopes that she could find a way to do things differently and move forward in her career. Next slide. And so the first question that I asked Liz, and that I want to pose to you as well, we're going to have a couple of polls coming up, but for now, you might just want to put your responses in the chat. There's so much difficulty, the VUCA environment that I would imagine all of you can relate to. I think an important question to start off with is what parts of this are under your control and what parts aren't? And as you can see from this pictorial, that often we would like to be in control of a very big sphere of things, but unfortunately, what we can control is actually really tiny. You can see that from the small red dot. And I think that's true in the practice of hospital medicine, the volumes of patients, the understaffing, the expectations, the measurements, all of the compliance metrics, all the care and feeding of the EMR, what your hospital CEO earns. All of these things are not under your control. And so one thing that we're looking at with mindfulness is really getting to know where we're putting our energies. And for Liz, she really began to see that she was dissipating a lot of emotional energy in things that she had absolutely no control over. And really what I wanted for her and what I want for each of you is to really be very intentional about how you expend your energy because it's limited. And like Liz, many of you may have young kids, you may have elders that you're taking care of. There may be other health problems, financial problems, et cetera. All of the uncertainty about the future of the pandemic. And so that's the first lesson that I want to bring home, that for Liz, when she began to really think about all that energy she was wasting on things she couldn't control, she began to change a little bit how she was thinking about things. And she could notice, there I'm going, ruminating about something that isn't going to help me and that I can't control at all. I think I need to shift my energies elsewhere. Next slide. And you'll see here my canine friend, Miss Sydney. And I think it's fair to say that canines and probably felines don't really experience a lot of burnout, right? And many of us look at our dogs and cats and birds and whatever pets we might have and really think, what a nice life they had. You know, all they have to worry about is a good meal, a place to sleep, and somebody scratching under their head. But for us, as I said, in burnout, we can be very disconnected from our strengths. So some of the questions that I posed to Liz that I want to just ask you to put responses in the chat. Do you focus more on your strengths or your weaknesses? Do you focus more on what you've accomplished or what you haven't? And do you pay more attention to what's going well or what isn't? And I'm just opening up the chat here. So please feel free to put any responses in there because Liz was aware that she was not really focusing on her strengths. She was somebody who got into bed at the end of the day and actually did a little bit of inventory of everything she felt she could have done better. She would review cases. She would think about what she had to get done the next day. She would really feel like she wasn't accomplishing anything. She was really also think about what wasn't going well. When she would come home at the end of her shift, she would complain to her husband about this didn't go well and that didn't go well, and didn't really stop to focus on actually the cases that had gone well. And I can see from some of you in the chat, I default to focusing on what's not going well. I think our culture is to focus on where we can improve as opposed to certainly where we're doing well. More on the negative. Yeah. I have to be intentional when thinking about what I'm good at and what I'm grateful for. Mm-hmm. Mm-hmm. Can see what everyone else is doing and achieving that I'm not. So we're starting just to kind of look a little bit at what's going on behind the scenes. I think it's all too obvious what the problems are, and it's easy to find ourselves focusing on them. Next slide. And it's the negativity bias, this kind of funny pictorial that there's the heart looking at all these good things going on. Brain, look at this. Good, 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 good. This lovely butterfly here. And the brain is saying, not now. Can't you see I'm busy? I'm looking at the one bad thing. So this is the natural gravitational pull that the human brain has towards the negative. We come by this honestly. And then many of us in our training kind of learn to be hyper-focused on things we're not doing well. And someone writes here, focus on both, happy about the good things, try to find ways to learn from the bad. Next slide. So, with Liz, she really wasn't sure how she could continue in her career. She was frustrated. She was concerned. She was exhausted. She felt guilty for coming home and being irritable with her kids and her husband. And she really wondered, can I last? Can I stay in my career? Should I leave? Should I do something else? And so we kind of walked through, well, what are your options? So let's look at that. And this is probably a short list, but one, of course, is to work towards systems reform. So needed. In 2017, it was kind of a shock when somebody would say things like, this is the canary in the coal mine of a dysfunctional system. I think we all agree now that the system is severely dysfunctional and so in need of reform. So anything any of you or your colleagues are going to do to improve that, of course, I think we would all applaud. What are some of the other options? Well, the other options are leaving clinical practice, retiring early, and certainly many physicians are doing that. Sadly, some physicians are developing self-harming and maladaptive behaviors. I get physician referrals from some state physician health services where somebody's thrown something in the OR or somebody screamed, and I certainly don't want that for any of you. But lastly, we can build resilience to the difficulties that we face. Now, that's not to say that you're not already resilient. A study came out in 2020 in JAMA Open Network that actually looked at over 5,000 physicians and compared them to the general public. And not surprisingly, physicians on self-assessment were more resilient than the average Joe in American society. So this isn't about a paucity of resilience. This is about applying the resilience that you have with tools like mindfulness to help you weather this VUCA environment, to help you weather all of the difficulties, the high volume, the difficulties with staffing, all of the problems that exist in the hierarchy of medicine that each of you face, all the complexities of chronic illnesses that, of course, you don't have a cure for. So I want to be clear about this. This is not a situation of saying that somebody's to blame, that there's a deficit of resilience. There's not a deficit of resilience. And I can imagine that that's true for each and every one of you listening to this call. But this is about applying that resilience so that you can make it through the marathon of your medical career. Next slide. And that takes me to a question, and we'll run a poll here. Do you feel that your training gave you what you need to manage the stresses of this time? So please take a moment. Simple yes or no. Did your training give you what you need to manage the stresses of this time? And do your best guess to guesstimate whether it's a yes or a no. And Jennifer or Sarita, I'm not sure that I'm going to see the results here. You may have to read those out for me. Can one of you unmute and read out the results?
Jennifer, do you have the results?
Yes, give me 1 second. I think some people are still.
Okay, thank you.
And then I'll share the results.
Wonderful. Okay, so look at this. 83% of you said no, that your training did not give you what you need to manage all the stresses. And some of you, 17%, congratulations, your training did cover that. So I think it's interesting that when we look at all the rare diseases that we cover in our training, all the pathophysiology, all of the biochemistry, all of the things that we learn. And yet, for most of us, whether you're white haired like me or whether you're younger, we actually don't learn a lot about how to train our minds, how to manage all of this, how to apply our natural resilience to all of these difficulties. So, next slide. Did you instead learn in your training some of these things that you needed to strive for perfection, that unattainable standard by definition? Did you learn that your self-care was not important and needed to be deferred? Did you learn to deny your own physiologic needs, never call in sick, be highly self-critical, compare yourself to your peers, and be looking hypervigilant about the ways that you believe you're coming up short? Did you learn, unfortunately, to feel a sense of shame and blame if you didn't have the right answer, to hide your struggles, and to never ask for help? And we don't have time to do another poll question here, but in groups of physicians that I've given this talk to, this is what people say in their training, that unfortunately, the pattern was that if we didn't have the right answer, we could really be blamed, even if it wasn't clinically significant. We were compared to others, and we learned to be very harsh with ourselves, leaving ourselves even more depleted on top of all the physical demands, unable to really see our own strengths and goodness and accomplishments. Next slide. And so when I talk about this client, Liz answered affirmatively. She hadn't learned how to take care of herself. She never called in sick. She had once thought that was a badge of honor. Now she realized that it was actually just foolishness, that she'd really ignored her own body. She hadn't learned how to moderate her own mind, how to work with all the busyness, all the thoughts, how to compartmentalize it and close the door on her cases so that she really could be home and enjoy her family life. So we did some work around mindfulness. Now, what is mindfulness? It's a bit of a buzzword these days, but really what it is the awareness that emerges when we pay attention on purpose in a very purposeful and careful way. And we're paying attention to the present moment, whatever it is that's in front of us. And as you can see in this definition, we're trying to be non-judgmental to the moment by moment unfolding of our experience. This definition comes to us from Jon Kabat-Zinn, one of the pioneers in bringing mindfulness into the modern Western world. I'm not so sure that we'll ever reduce ourselves to not being judgmental. The human mind has a lot of judgments, and the physician's mind needs to make a lot of judgments. But I think what he's getting at in this definition is how we can lower the judgments, which are often negative, and how we can increase the level of compassion, both to ourselves and to others. And what's important about mindfulness is that it can lead the mind back from theories, attitudes, stories, and abstractions that we all have. It's what all of our minds do, and can take us back to the experience itself, which can help us step out of being prey to our own prejudices, opinions, projections, and expectations. So in a sense, we're freeing ourselves from the straitjacket of unconsciousness. Next slide. The human mind is a busy place. It's estimated that our minds produce 20,000 to 50,000 thoughts a day, a crazy number of thoughts in any given hour. And I think for us as physicians, the numbers are probably quite a bit higher. But maybe your mind isn't as busy. Maybe you're good at monitoring your thoughts and kind of having a quieter mind than some of us. So I wanted to just do a quick exercise, 90 seconds. And what I'd like you to do in this 90 seconds, and I'll tell you when to start, is to count your thoughts, to imagine that you're almost like a cat at a mouse hole, ready to pounce every time a thought comes into your mind. You can keep a tally of the number of thoughts, or you can just kind of mentally notice 1, 2, 3, however many thoughts you're having. And then we'll launch another poll at the end of the 90 seconds, just to see how many thoughts you and your colleagues had. So we will start now. So just counting how many thoughts come into your mind. That's 30 seconds. That's 60 seconds. And that's 90 seconds. So Jennifer, if you can launch that poll. Great. So please note and let us know, did you have one thought, 2 to 5, 6 to 10, or too many thoughts to count? So just take a moment and answer that if you would. And while you're completing that, I'm noticing there's a little background noise on my end. Would it be helpful for me to put in my earbuds, or are we good?
Sound good to me.
Yeah, sounds good.
Wonderful. So good. Whenever you have the results, let us know. Okay, so 5% of you had one thought, 15% 2 to 5, 30% 6 to 10, and look at that, half of you, too many to count. So luckily, this isn't a bad disease. It's simply the busyness of the mind. And that's only in 90 seconds. And let's go to the next slide. And the next, please. And when we stop and pay attention to our thoughts, we begin to realize that while many of our thoughts are exceedingly helpful, some of them actually are not. And this is just a quote from a Buddhist text. What is thought? Thought is your friend, thought is your enemy. No one can harm you as much as unwise thought, and no one can help you more than wise thought. So I think helpful thoughts and wise thoughts are pretty easy to identify. Okay, that triad is Lyme disease. MRI with gadolinium, as we heard from Julia. You know, what did the most recent study show? Oh, that's right. That's what I learned at Grand Rounds. Incredibly helpful thoughts. Get dressed, you know, start the car. But as we begin to pay attention to the mind with that quality of mindful awareness, we begin to see just how many of our thoughts are actually not helpful. And in this case that I'm presenting Liz was really beginning to be aware of all the unhelpful thoughts, the noise in her head, the fact that she couldn't stop thinking about her patients, worrying, did I get the right test? What's going on? Do I need to log on to Epic and see what's going on, even though it's my Friday night off with my family? Thoughts about the healthcare environment, fairness, unfairness, respect, lack of respect, things that really were just kind of going in her mind. Next slide. And so many of our moments, we're not really paying attention. And I hate to call it mindlessness, but I think that's what some people would call it. We're on a type of autopilot where we're having all of these thoughts and stories about our lives, and we're not really aware of what's going on right in front of us. As I said, Liz couldn't even feel her 3-year-old sitting in her lap, wanting to cuddle and having some mommy time. Our mind is flitting about from past to future, worries, replaying arguments, worrying what's going to happen next, frustrations, annoyances, can really leave us feeling very stuck and rigid, and can also leave us very reactive. and not in our usual staid professional response. Now, you can see here, this is the ultimate mind-body dissociation. Our body is always present by definition, but the mind is here, there, and everywhere and creates a tremendous amount of stress and anxiety and fuels burnout, just as the busyness of our days does so. Next slide. And without mindfulness, we kind of go a little bit like the marionette that you can see here. We go from stimulus to response, sometimes like this. 0 to 90. With mindfulness, however, next click. With mindfulness, we realize that something's going on, that there's a stimulus here that perhaps was triggering to us. Maybe it's an extra admission from your ED. Maybe it's a consultant, kind of acting like you should know what you're doing in a case and shouldn't have bothered them. Maybe it's your teenager sending you a text, but that's a stimulus. And instead of going from stimulus to response, with mindful awareness, we can be aware, what's going on for me? Wow, my emotional temperature just rose. I need to take a pause here, a very brief timeout, because I have a choice. I can respond like I did without mindfulness and maybe regret something that I say, but I can also respond from a much more kind of poised and professional way. That's the choice that we have moment to moment. And with mindful awareness, we can see that choice more readily. Next slide. So there's an exercise that I want to just go through with you called the STOP protocol that helps us take exactly this type of pause. Bring to mind right now anything that you're struggling with. Perhaps it's an argument with somebody, something that you felt like somebody didn't treat you well, didn't treat you with respect. Bring something to mind right now, not a 10 out of 10 difficulty, but kind of a minor to moderate difficulty. I'm sure there's one you can bring to mind. Maybe it has to do with staffing in your unit. But bring that to mind right now. And following this protocol, we'll just pause here, kind of hit the brakes on this mental reliving of this difficulty, and just take 3 slow, deep breaths. Now imagine that you stepped out of yourself and you stepped into the role of a neutral yet compassionate observer who's watching you in this difficulty. And in fact, this observer knows something about you. They know the difficulties that you face and they know how hard you work. They can see that. They know how much good you bring and how you always try your best. So imagine for a minute how this same scenario would look to this observer. What would they see? What would they say to you? And based on what you imagine this kindly observer seeing and saying, I wonder if you can just praise yourself in any way, small or large. Praise yourself about this difficult situation. That could be, I'm doing my best. I'm trying as hard as I can. My intentions are rock solid good. So praise yourself. And now, having taken this purposeful pause, see if things maybe look differently. If there's a new step that you might try out that's aligned with your values and aligned with how you want to be showing up. Liz learned to take these pauses, and of course, they weren't a magic elixir, but she needed some space between the busyness of her days, her home life, and her work life. And taking purposeful pauses helped her moderate her own emotional temperature, helped her pause and take breaths and reset and bring in the autonomic nervous system so that she could respond in a way that she felt really proud of at home and at work. Next slide. And I want to just briefly touch on the neuroscience because this is an area of so much research, all of the impact that even brief periods of meditation have on the central nervous system, shrinking the size of the amygdala, our fight-flight center, increasing gray matter in really pivotal areas of the brain that can help us, particularly in the prefrontal cortex, obviously help us with executive function, but also areas that like the hippocampus, the insula, many areas of the brain. And this is really a growing area of research. Certainly, we understand that even brief periods of meditation, 8 weeks of meditating 15 to 20 minutes a day, increase telomere length and increase parasympathetic tone, countering the fight or flight that we can find ourselves in. Next slide. The benefits of meditation and a mindful awareness approach go well beyond the effects on the central nervous system in terms of what we can see, let's say, on fMRIs. Decreasing depression, anxiety, improving sleep and sleep hygiene, improving immune function, decreasing cortisol levels, increasing coping. Tremendous benefits. And we could spend, a session, if not more, on all of the benefits that we're understanding from mindfulness and meditation. Next slide. And certainly of interest to all of you, mindfulness is helping to decrease burnout. And this was one of the first studies. This came out in 2007, I believe, in JAMA. This is from the University of Rochester Medical Center that looked at a mindfulness intervention in 70 primary care physicians. And it was initially an 8-week program, and then there was actually a 10-month maintenance program once a month after the initial 8 weeks. And there were significant decreases in the emotional exhaustion, the difficulty seeing one's accomplishments and meaning, and also significant decreases in the sense of cynicism and depersonalization that goes along with burnout. And since the time that this study was published, almost 15 years ago, there have been quite a few studies on the benefits of mindfulness in reducing burnout. Next slide. And so the next thing that I want to talk about, we don't have a lot of time left, but another way that mindfulness can help us is building the muscle of compassion for self. I can only imagine that each of you brings tremendous compassion to the patients that you take care of, to your family members, to your communities. And yet, as we saw in that slide about our training, many of us don't learn how to bring that same compassion to ourselves. And if we spend our days bringing compassion to others and not to ourselves, we're really saying that others deserve kindness, care, and goodwill, and that somehow we don't. We're excluding ourselves from the circle of humanity that can benefit from compassion. Kristin Neff is one of the major researchers in this growing area of self-compassion, and she suggests a very simple question. If you're going through a difficulty and you're being hard on yourself, you're judging yourself, as some of you put in the comments, to simply pause and ask yourself, what would you say to a friend or a family member who is struggling in the same way? In other words, can you bring that same lens of kindness and compassion and goodwill and caring that you bring to so many others to yourself? Next slide. There's so many benefits from self-compassion. And interestingly, there are hundreds of studies now on self-compassion improving depression, anxiety, building motivation, improving body image, self-worth, resilience. And we're just beginning to see some studies about self-compassion in physicians. This one, for example. And I'm happy to share some of the references if that can be helpful. So just really quickly now, again, if you think about the difficulty that you brought to mind a few minutes ago, if you can bring that back to mind, or any other difficulty that's coming to you, whatever that is in your home or professional life, just to lead you through what's called a self-compassion break. Really realizing that what you're going through is difficult. Whether it should be or shouldn't be, whether it's difficult for others or not, is not the issue. It's difficult. And so you deserve compassion because it is difficult. And when you think about it, that exercise of stepping into the observer can help us see that difficulty is part of life. It's certainly part of the life of a physician, of a busy hospitalist. It's difficult. These are stresses and strains that many of your colleagues experience. And how can we bring that same kindness to ourselves? I'm just going to say a few phrases and you can repeat them mentally as I say them. May I be kind and compassionate to myself. May I bring the same goodwill to myself that I bring to others. May I remind myself of how hard I'm working, whether other people acknowledge that or not. And may I bring many, many moments of calm into my days. That's what's called a self-compassion break. So along with purposeful pauses, trying to see your own strengths, that's another strategy, a very practical mindfulness strategy that I want to encourage you to try out, even if it seems artificial and downright false in the beginning, because again, we can be so unfamiliar with that kindness to ourselves. Next slide. So I just want to close here. I developed a mindfulness mini course specifically for physicians. And I walk through in a 14-day course, 10 minutes a day in an audio that you get in your inbox. I walk through a simple mindfulness topic, and then I lead a guided meditation. And if that can be helpful to any of you or your colleagues, it's free. You can download it at my site, gailgazelle.com. Next slide. And if I can be of help in any way, my email address is there, info@gailgazelle.com. I also lead a fairly popular Facebook group, private Facebook group, Mindful MD. So if you're interested in this topic, that's a place that you can join us. So just before we open it up to a couple of questions, we covered a lot of ground, so many difficulties, unprecedented, really unexpected difficulties in healthcare that each of you are facing on a day-to-day basis. And like Liz, the hospitalist that we followed in this discussion, the mind can be a very busy place in addition to all the physical busyness of your days. And yet we can gain more agency with our minds, with mindfulness and with mindfulness practice. We can help our brains. We can reduce levels of depression and anxiety. And I want to just encourage you to try out the purposeful pause, try out that self-compassion moment. You may be very pleasantly surprised at how it can help you.